In Lesson 5, we're going to go over one of the full skill sets of Birthing Better. It's about the breathing, communication, and touch, and also the importance of practicing these skills. And the positive and negative voice. How do you deal with the negative thoughts you might have about the sensations you have or what's happening to or around you, and how you use skills to cope, manage, deal with, handle, stay on top of, feel in control. There are 2 breathing modules. One is helping you understand how all humans breathe. That's very important. That means that we and our birth coach can share a common set of skills when we understand our human breathing. Yet we can also direct our breathing. We're not moving our lungs, we're just intentionally inhaling into a certain part of our body or exhaling from that part of our body. That may sound complex, but we're told that there's chest breathing and belly breathing. The lungs didn't move down into the belly, so we've directed our breathing down into our diaphragm. If you just breathe in now and expand inside your pelvis, and you just exhale and soften inside your pelvis, then you'll understand what directed breathing means. Since fathers were just coming into birth when Birthing Better skills were developing, and that was in the framework in the United States of Lamaze and Bradley classes, both of which had birth coaches as the father, Birthing Better did the same thing. That was a good thing. We wanted somebody to help us, and if we could share a common set of skills, then we worked together better. The question was, how well did we communicate? Us as a birthing woman, did we communicate to our birth partner well? Did they communicate to us well? Did we communicate inside ourselves well? Did they communicate inside themselves well? For example, birth coaches don't always understand the messages we're giving. They may reach out to touch us and we may flick their hand away, in which they may never touch us again. So Birthing Better families developed the nonverbal and verbal communication skills that you're going to find in the modules in this lesson. Touch then became very important. If a birth coach reached out and touched us and we flicked their hand away, then they assumed we didn't want to be touched. We just wanted to be touched at the right time, in the right place, and in the right manner. So Birthing Better families developed that skill, and we learned that that skill actually isn't a comfort touch so much as it's a cueing touch. By using the deep touch relaxation, our birth coach cues us to soften inside our body. Now, communication also has to do with what we're saying to ourselves as birthing women. The natural birth movement would like all of us to believe that birth is this highlight experience, which it is, this orgasmic experience, which most of us don't experience, and sort of the best experience of our life. But that's not what most people feel. Most women can range from loving birth to feeling they're going to die. So Birthing Better families wanted to develop a way to deal with those negative thoughts. So Birthing Better families developed a way that we can choose our managing skills alongside our negative thoughts. And that goes for our birth coach as well. Most of us are never at a birth. And for a birth coach to see a woman looking sweaty and red with dank hair, or pale and exhausted and moaning and groaning, the internal voice of that birth coach is to say, oh my God, help her. She's in such pain. That pain must be a problem. So the positive and negative voice module helps both us as birthing women and our birth coaches to continue to use our skills, even though our negative voice is very loud. And the reality is, even if a problem is exhibiting itself, the deeper we use our skills, the more consistently we use our skills, the more empowered we feel, and the more we are able to deal with and cope with what is unfolding. Now it comes to the word practice. Look the word practice up in any dictionary. It has several meanings. We do a practice like a meditation. We practice our skills. With birth, we cannot practice before birth unfolds. All Birthing Better skills, with the exception of the body work, can be practiced while we're doing other things. I'm sitting in the chair now, and I can make certain my sit bones are as far apart as possible to let this big object out. I can consciously soften inside while I'm talking to you. You can do this as well. By practicing these skills, you own them. Once you own them, begin to apply them. When do you apply them? Many Birthing Better families apply at least the breathing, communication, and touch skills when they're bored or when they're anxious, sitting in a doctor's office or having a test done. But when it comes to labor, we begin to use these skills more and more in the last few weeks when we begin to feel some change occurring. If we're having a non-laboring cesarean, we practice these skills as though we are going to labor, and then we use them in the car going to the hospital while being prepped and during surgery. And why do we do this? What is the fundamental reason? One, as we've talked about, coping, managing, dealing with, handling, staying on top of, and feeling in control of both internal sensations and what's happening to or around us. That's one of the reasons. Underneath that is an infinitely more primary reason. We get pregnant to have a baby. We don't get pregnant to have a type of birth. This is our baby's birth. We're not going to be able to do it tomorrow. We may never do it again in our lifetime. We both have the joy of and responsibility to be as skilled as we can as parents. Many people believe that birth is when we become a parent. Birthing Better families believe when you become pregnant, you are a parent. Many people will say to us over the last 50 years, I don't have time. And we say to them, once your baby is born, will you find the time? And the answer, of course, is yes, but your baby's already here. That's important. Your baby is already here. Take the time to learn, practice, and use your skills throughout your baby's birth. You will birth better. Your birth memories will be more empowered. And knowing that you can have negative thoughts, you don't have to like any of it. However, you are still going to do the activity of birthing your baby. And as humans, we thrive on doing all activities feeling competently skilled.